Good afternoon. Welcome to today's webinar, and thank you for joining us today. My name is Carol Reese, and this is Donna Marin. We are both practice advisors here at the SRNA, and we are going to facilitate this webinar today. Before we start, I would like to acknowledge that this presentation is being held on Aboriginal land and recognize the strength, resilience, and capacity of the Treaty 4 and Métis people of this land. Our topic today is tools for resolving professional practice issues, and it's a focus group. We want to gain feedback from our members on the document that's being created before it's finalized and rolled out for use by the members. Before we get started, I have a couple notes as to how you can engage the presentation. As a viewer to this webinar, you'll be able to hear and see the presentation. Only panelists will be able to speak throughout the presentation. If you have a question, please add them to the Q&A or chat sections. We'll be monitoring this area for questions throughout the webinar, and these questions will be answered either live or via text response. If you wish to send your question anonymously, just check the box at the bottom of the Q&A screen. We'll be recording this webinar as it may be posted to the SRNA website for those who are not able to join today to view later. An email will be sent to you with a link for the evaluation, and we hope you will get a couple of minutes to complete the quick survey. And that's the end of the housekeeping items, so we'll get started. So our tools for resolving professional practice issues is a document and some tools that we've had in the past on our website to address professional practice issues, obviously. We have updated it, made it more current, put in some few little different extra tools, and we'd really like to see what the membership thinks of this tool and then be able to enact it. Donna?
Yes, we're actually very excited about relaunching this toolkit. As Carol was saying, we have had this particular document since 2008, and it was really time for a revision and an update. As well as we really wanted to make the document more intuitive and easier to follow and a little bit clearer. We do recommend this document to our members quite frequently when they call with a professional practice issue or they're questioning if they have a professional practice issue. This document helps them sort that out and to be able to kind of follow through on resolution of that issue at the lowest level where they are employed. So I'm really excited to get people's feedback. And certainly the document has been put on our website for people to access and review. The consultation period is up until 4:30 on the 11th, which is next Friday. And there's a SurveyMonkey electronic survey that people can complete with their feedback. So if you're viewing this later and you are interested in this document, then please go ahead and provide feedback that way.
Okay, so we'd like to gain feedback on the following: the structure and content of the document, the 5-step framework that we have laid out to help resolve the issue, the various tools within the documents, and then as well the overall clarity of the document.
So the document is a support tool, as we mentioned before, and it is intended to help people work through that process. It's always used in combination with the RN practice standards and the code of ethics to seek resolution at that lowest level. And so I just want to point out that at our annual meeting in May, one of the items that was presented to membership for their approval was the RN practice standards. Have been separated out from the RN entry-level competencies. And so previous to that, people would have been using the standards and foundation competencies for registered nurses, but now they're using it as a triad of the practice standards, the code of ethics, and the document. And it is the third most commonly recommended document during our practice consultations. And often we find that it can be used either independently when you identify a professional practice issue, or sometimes with other like-minded colleagues. And so sometimes when you've been trying to address something in your workplace and you realize that you know, there's a whole group of people that are also, you know, sharing that concern. It can be really strong when you all put together the document and identify where the issues are and work towards resolution.
Okay, the introduction section of the document articulates the reason for the document, and I think Donna has actually outlined quite well what the reason is for the document. It defines what a professional practice issue is, and that could be any situation that puts a client at risk or interferes with the RN's ability to uphold the professional standards of practice, the code of ethics, employer policies, or other best practice clinical standards. We give a definition of the toolkit. We articulate the basic principles, which I believe there's 5 of them. Be specific and factual. Once you've identified the professional practice issues, start with verbal communication. And as always, with everything our nurses do, please document that. If written communication is required, please keep a copy of that correspondence and treat all documentation as confidential. Work collaboratively in a respectful and professional manner to resolve the issue at the lowest appropriate level, involving only those required. And if it's not achieved, we give some direction on how to escalate it to higher levels in the organization, as well as keep your manager informed of what you've done. And then resolution is not always immediate. We have to be mindful of that. Continue to respectfully and diligently work to improve client care and resolve the issues. And of course, follow up if you haven't gotten a response in a timely manner or haven't seen any resolution. As well, we articulate both the responsibilities of the RN making or identifying the issue and bringing it forward, and as well the employer responsibilities in trying to work towards resolution of that issue. Is there any, oh, carry on, Donna, never mind.
So the next section is the 5-step PPI, or professional practice issue resolution framework. And so just to kind of walk through it for any viewers that maybe haven't had a chance to review this before, this was newly created for our document. So really it talks about identifying the professional practice issue and then making a determination of, does it present a risk to the client? And when you follow through the decision tool, if it's yes, then you move on to steps 2, 3, 4, and 5 and keep working through there to the point where it either is resolved and the situation is ended, or, you know, then you need to loop back if it's not resolved, back to 2 and start over. The other way is if it does not present a risk to the clients, does it conflict with standards, guidelines, and or policies? And so sometimes when we're doing practice consultations, we find that people will phone in and say, there's a new policy in my department that doesn't allow me to adhere to the standards that I have to uphold as a registered nurse. There may be, you know, policies that are so outdated, and now the practice needs to change, but they don't have that guidance for a new employee or whatever. So, you know, really the key pieces of deciding about a professional practice issue are those couple of boxes, because if in fact it does conflict with your ability to adhere to the standards, guidelines, and or policies of the agency, then yes, you probably do have a practice issue and would follow through steps 2 to 5. But if not, then it's probably not a professional practice issue, and you know, you should still respond or refer appropriately, because there may be situations that still need to get addressed. One of the things that you know, happens with this toolkit is that it can be used by registered nurses or NPs or RNs with additional authorized practice in their practice settings, that they identify it, but sometimes it's a manager who either is an RN or a manager who's a non-RN who either identifies things as a professional practice issue or wonders if it is. So they may also use this tool. Some of the things, you know, when they're questioning, is it a professional practice issue? And they go through and say, well, does it, you know, present a risk to clients, or does it conflict with standards, guidelines, or policies? You know, maybe professional tardiness is something that, you know, that they're wondering about. So it may present a risk to clients if people aren't showing up and doing their job on time, but it may just in fact be a performance management issue, and then it follows a different line. So anyway, this is a newly developed tool for us, and we're just seeking some feedback on whether people think that we should keep this as it is, whether it requires any additional steps, or whether any steps should be deleted, or whether it should be modified in another way. So if you think that it's keep as is, that's simple. But if you think that there needs to be additional steps or steps deleted, we want people to be really specific in that, so that we know what that looks like. So the steps are all color-coded and pretty straightforward. Step 2 is where you explore the issue and define how client care service is affected. 3 is identify resources, 4 is take action, and 5 is evaluate. And then you ask yourself that question about whether it's been resolved or not. So as you work through that, you may have feedback already, or you may want to watch the rest of the presentation to further understand each of those steps individually, and then give the feedback. So I don't see that there's any feedback right now, so we'll move on to the next slide, and then if anybody has stuff later, that would be wonderful. Or you can submit it electronically.
Okay, so step 1 is identifying the professional practice issue. That would be questions to consider. Does the issue present a risk to the clients? Does the issue affect all clients or just an individual client? And does the issue interfere with your ability to practice according to the registered nurse entry-level competencies, the registered nurse practice standards, which come into effect October 30th, and or the Code of Ethics for registered nurses? And if you've answered yes to any one of these 3 questions, you have identified a professional practice issue. So again, as mostly with the other previous step and then the next few steps, is there anything else that you feel would be helpful or relevant to add? Should we keep it as it is? Are there any questions that may delete or reword, modify it? If anybody has anything that they would like to reply, please be specific in your response, and we'd be happy to take your feedback.
Great. So step 2 is explore the issue and define how client safety was affected. And so in this one, there is a list of questions, and there's also a tool that kind of asks those questions and allows you to walk through it. All of the appendices that are at the back of the document will be dealt with in a later section. But these questions are really about did it, you know, affect your ability to adhere to your practice standards or code of ethics or agency policies and procedures? What factors might have contributed to the PPI, and it helps you kind of really sort out what the issues are, so that as you advance trying to resolve the issue, you can, talk about on that particular shift or during the time frame that you're looking at. Was there a shortage of equipment, or were there workload issues or staff mix issues that might have contributed to your inability to adhere to your standards, or that impacted client safety? Sometimes it's about, staff that don't have adequate orientation, education, or experience to deal with particular issues. And so if people aren't getting the correct, orientation and support that they need, that can compromise patient safety or standards. There may be conflict or communication problems. There may be, policies or procedures or a lack of that contribute to it. Some professional practice issues are recurring and others are not, but they still, need to be addressed to prevent a recurrence. So there's a whole list of questions there, and then there's a section that really lists the factors that that those things might impact. So it's your competency, responsibility, or the competency of someone else, I guess, the responsibility, the standards, accountability, communication, policies and procedures, physical resources, human resources, and legal or ethical issues. So it kind of helps you walk through that exploration of the issue. So again, either your recommendations would be to keep this section as it is, add some additional questions that might help clarify the professional practice issue and how client safety or standards were affected. You might want us to delete some of those questions if they're redundant. Or you might want us to modify this document in some other way to make it more readable and user-friendly.
All right, step 3 is identify resources that may be helpful in resolving the professional practice issue. Because you've identified one doesn't mean you have to go it alone. There are others out there, or other resources out there that can help you in resolving the issue. Some internal supports could be your charge nurse, your manager, your clinical educator, perhaps a colleague or a mentor, or even the human resources department. External supports, could be an SRNA practice advisor, Canadian Nurses Protective Society, perhaps a union, and even employee assistance program. And then there's also resource documents. Many of them are ours. The Registered Nurses Act, 1988, Registered Nurses Entry-Level Competencies, Registered Nurse Practice Standards, Code of Ethics for Registered Nurses, and even agency policies and procedures. Now, this list is not exhaustive. There could be other supports out there. Seek those that are beneficial and would be of help in resolving the professional practice issue. So again, as with all the rest of the tools, we're seeking your feedback. Should we keep this as it is? Are there additional resources that we could add, or some other resources perhaps that maybe we should remove? They may not be that helpful, or any other sort of modification or change you think would be helpful. And again, please be specific in your responses.
So step 4 is all about taking action. You've gotten to the point where you've collected the information and identified resources that can assist you in taking that forward for resolution. And so, we really, this step is about taking it to whoever is the most appropriate person at the lowest level to try and resolve it. So we're suggesting providing the manager with an objective and detailed description of the PPI and focusing on how it did or could have affected the safety of a client and or your ability to practice according to the registered nurse practice standards. Sometimes over a period of time when I've been working with this document with folks, sometimes they want to work in things that are more focused on the collective agreement that exists and talk about, a charge pay or other issues where the union is certainly the best resource for resolving those particular issues. This is not that kind of a document. It really needs to be focused on on safety or standards. So I'd recommend when people are working their way through it that remains the focus. So one of the tools that exists is in Appendix D, which includes a brainstorming tool, which helps you kind of look at possible solutions. And during this section, it actually talks about and makes suggestions on meeting, discussing the issue, if there's an agreed upon action that is struck to resolve the issue. And it's important to kind of track that because you want these professional practice issues resolved in as timely a manner as possible and with as much clarity as possible about who's going to take responsibility for certain actions during this section. So once people have had a chance to read through and look at it, certainly again it would be a matter of suggesting that we should keep it as it is, or that we need to add some content or delete some content or modify in some other way to make this step as clear as it could be for the people that are using the document.
Okay, step 5 is an evaluation of if the professional practice issue has been resolved, and then identifying what the next steps are going to be. So once the action has been taken, you need to see if it's evaluate it to ensure that it has in fact been resolved. This may take some time. Not everything can be addressed in a rapid manner, I should say. Sometimes professional practice issue isn't resolved, and if it hasn't been resolved, you might want to take a step back and consider some reasons why it perhaps wasn't resolved. Was the issue clearly identified? Were you able to define how and when a client was affected? Were the right people involved in the discussions and the attempts to resolve it? Is there evidence your manager took steps to resolve the issue? And what could have been done differently to perhaps address this issue? If your manager decides that they're the most appropriate person to manage the professional practice issue, which in most cases likely would be, it would be good to know, it would be good if the manager would inform the person who's brought forward the issue that it has been resolved. They don't have to tell them all of the details as to, the conversations and the steps and all that that's been taken forward, but just to let them know that it has been addressed. Oftentimes confidentiality comes into play, so they can't provide you with all of the information. Once you've considered the questions about why it may not have been answered, there's next steps you can take. If you haven't met with the manager, you can request a meeting to discuss professional practice issue. If you've already met with the manager and the issue persists, ask to meet again to determine when a resolution is likely to occur. Consider discussing the issue with the next level of management in your agency. And you can also contact us here at the SRNA for some advice. Great. Again, as with the other steps, is there anything we can add or we should delete? Keep it as it is. Any modifications you think would be helpful for those using the tool, please be specific.
So then there's a number of tools that are listed at the back of the document as appendices. So the first one that exists in there is the questionnaire, where you're actually trying to determine that you in fact do have a professional practice issue. Tool Appendix B, Tool 2 is linking the issue to professional practice expectations, and there's a number of things in there that would help you walk through that. And it also has an area there where you can record who you gave this information to, the date a response was received, what that looked like, signatures and stuff, and make some suggestions. There also are documents that are linked in there so that people can click on them and use them. Appendix C is a tool number 3, which is your organizational chart. And so knowing that all organizations are set up fairly differently, you know, there may be other titles in your context of care. However, the roles or the functions that people play, you know, certainly you could substitute those in, but for the most part, it's, you know, taking it again to the person at the lowest level. So that could be the charge nurse on a particular day, a supervisor, your manager, a director, chief nursing officer, up to the VP, you know, to the CEO. If you feel that you haven't got resolution at any other level, you know, do have an obligation to decide how far that needs to go. And then certainly practice advisors at the SRNA can be called at any point. And then Appendix D is tool number 4, that brainstorming tool that I mentioned earlier, with potential solutions to resolve the PPI, and what the potential positive outcomes or negative outcomes or level of risk, I guess, you know, that exist. And then checking which one is the best approach. So certainly, you know, there's lots of opportunity to work through that either independently or collaboratively with someone else that either is a like-minded colleague or whoever you have reported it to at the lowest level.
Okay, Appendix E is meeting notes. Just goal is to send documentation to your manager so that the issue can be examined, solutions developed, and the resolution accomplished. If a meeting is held, both the agenda and minutes are part of the documentation of the process. You need to decide who will chair the meeting, what is the agenda, appoint a minute taker, and minutes should include the date of the meeting, the name of the attendees, issues discussed, actions to resolve the issue, and who is responsible for the agreed action when it is complete. At the meeting, a follow-up meeting, includes the outcome evaluation that occurred. It needs to be documented, and the template for documenting these meetings are on the following page. Appendix F is a sample letter that a nurse may send to a manager addressing a professional practice issue. Some details would be included as to the dates, the time, what the incident was. There's identification of the practice standard that is being because of the workplace issue. And then a date where the RN would like to see a response by the manager. So just outlining all of the details, giving some information so that things can get, so you can get the ball rolling. You can also use a memorandum with basically the same type of information, dates, times, the situation that occurred, and then identifying the standards. And Appendix G is a sample letter for the manager to respond back to the RN that the issue has been looked at. They have received the letter, just acknowledging that they're going to be taking it in this letter to the senior leadership team for some resolution that's done on it. And then I think there's one final letter where from a manager thanking them for the letter, and then consideration, consultation with others in the organization, and then what's going to be implemented by who, by what, in what time frame. And then also encouraging the nurse to contact the person who has sent the letter. So these appendices are the same as all the steps that we went through. Is there anything that we should add or adjust, delete? Is there anything that you think can make it a better letter for and more user-friendly for anyone who will be accessing this tool?
So that leads us to people's overall perceptions of the document. What we're truly trying to glean from our consultation over the 2-week period is, does the document clearly outline the expectations of RN practice for SRNA members? Does it clearly outline the expectations of RN practice for the public, stakeholders, and others that might be looking at that document. And we're wondering about any additional comments or feedback that people have to increase the strength or the clarity of the document.
And practice advice is one place you can contact us. You can email us. If there's anybody that has anything they would like to put forward right now, we'd be welcome to hear it.
Okay, I think probably people will take their time to review the document and use the electronic survey to submit their feedback. We certainly, welcome all of that, and thank you for your time today. It's been a pleasure being able to present the topic to you.
Okay, so thank you, Donna. It's fun co-presenting with you.
Yes, you too.
Okay, next week's webinar, we'll be covering the new ELCs and standards that will come into effect October 30th, and I will be presenting that. If you've missed a webinar, you can view many of them on our SRNA Vimeo or YouTube channels. And thanks again for joining us. See you next time.
Bye-bye.